alterations of neurologic function in children. The nervous system begins to form early in embryonic life, developing from the ectoderm through a highly complex and organized sequence. By day 40 of gestation, neural structures are forming, and by day 175, the brain has developed all of its major regions. Both genetic factors and environmental influences can significantly impact this developmental process. Head growth and skull formation occur simultaneously, with bones separated by suture lines and soft areas called fontanelles to allow for brain expansion. Cranial sutures are the fibrous joints between the bones of the skull, and they remain open during infancy to accommodate rapid brain growth. Fontanelles, the soft spots where sutures intersect, serve as flexible gaps that allow for the expanding skull. These structures close at predictable times during development and are important landmarks in pediatric assessments. Abnormal closure or shape can indicate underlying neurologic or developmental issues. Structural malformations of the central nervous system are a leading cause of fetal death and infant mortality. Most of these malformations are due to problems with neural tube closure during early embryogenesis. Conditions such as Arnold-Chiari malformation and tethered cord syndrome are among the more complex presentations. Early detection is crucial for planning supportive care or surgical intervention. Neural tube defects are classified based on whether they involve the front or back of the neural tube and may include severe anomalies like cyclopia, anencephaly, or spina bifida. Spina bifida occurs when the vertebrae fail to fully close around the spinal cord. Myelomeningocele is one of the most severe forms and involves the spinal cord and meninges protruding through a defect in the spine. Other conditions, such as encephalocele and meningocele, involve herniations of brain or spinal tissues through abnormal openings. This slide likely illustrates the range of neural tube defects, highlighting the differences between closed and open forms. These conditions may be visible at birth or remain hidden beneath the skin, making careful clinical examination essential. Severity depends on the location, size of the defect, and whether neural tissue is involved. Early diagnosis can dramatically affect outcomes, especially in cases requiring surgical correction. Spina bifida occulta is a form of neural tube defect that is not visible externally and typically causes no neurologic dysfunction. In this condition, the vertebrae are malformed, but the spinal cord and its nerves remain intact and undisturbed. It is often discovered incidentally on imaging for unrelated issues. Despite being asymptomatic, it may be associated with skin markings or subtle physical signs. Craniosynostosis is the premature fusion of one or more of the cranial sutures before brain growth is complete. When this happens, the skull cannot expand normally, leading to an abnormal head shape and potential increased intracranial pressure. The most common form is called plagiocephaly, which results in an asymmetrically shaped skull. Treatment often involves surgery to allow for proper brain growth and skull development. Microcephaly is a condition in which the brain and head are abnormally small. It may be a primary condition caused by genetic defects or a secondary condition resulting from environmental factors like infection or exposure to toxins during pregnancy. Cortical dysplasia, another brain malformation, occurs when embryonic neurons fail to migrate to their proper locations, leading to seizures and developmental delays. Both conditions can have lasting effects on cognitive and motor development. Dandy-Walker malformation is a congenital defect involving the cerebellum and the fourth ventricle, often presenting with a large cyst in the back of the brain. This condition can lead to problems with movement, balance, and increased pressure within the skull. Congenital hydrocephalus results when cerebrospinal fluid accumulates abnormally in the brain, causing the ventricles to enlarge. It may be caused by a blockage, overproduction of fluid, or poor absorption, and often requires surgical intervention with a shunt. Congenital hydrocephalus occurs when excess cerebrospinal fluid accumulates in the brain's ventricles during infancy or before birth. This can result from a blockage in the cerebrospinal fluid pathways, an imbalance between production and absorption, or structural abnormalities. As fluid builds, pressure increases, leading to enlarged head size, vomiting, and developmental delays. Early treatment, often involving the placement of a shunt, is essential to reduce pressure and preserve brain function. Encephalopathies are disorders caused by brain damage that does not worsen over time. Cerebral palsy is the most common static encephalopathy, resulting from a fixed brain lesion, often due to birth injury, infection, or developmental abnormality. The condition can be classified based on motor symptoms, including spastic forms with muscle stiffness and non-spastic forms that involve involuntary movements or poor coordination. While the brain injury itself does not progress, the effects on movement and function can change with age. Some encephalopathies result from inherited metabolic disorders in which the body cannot properly break down amino acids or fats. When these pathways are disrupted, toxic substances accumulate in the nervous system and damage the brain. Phenylketonuria, or PKU, is a well-known example in which the body lacks the enzyme needed to process phenylalanine. If untreated, it can lead to intellectual disability, but early dietary management can prevent severe symptoms. Phenylketonuria is a genetic disorder that interferes with the body's ability to metabolize the amino acid phenylalanine. Without proper dietary restriction, phenylalanine accumulates in the brain, leading to irreversible cognitive impairment. Routine newborn screening allows for early diagnosis, and a low-protein, phenylalanine-restricted diet can prevent most long-term complications. Lifelong monitoring is essential to ensure healthy development and prevent relapse. Children are particularly vulnerable to nervous system damage caused by toxins or drugs. Drug-induced encephalopathies may result from accidental ingestion or overdose of medications. Lead poisoning is a major concern, as even low levels of exposure can cause developmental delays and behavioral problems. When mothers are exposed to lead during pregnancy, the fetus is also at risk for neurological harm. Central nervous system infections in children include meningitis, which may be bacterial, viral, or aseptic, and encephalitis, which affects the brain tissue itself. Meningoencephalitis is a condition where both the meninges and the brain are inflamed, often caused by viral infections. Prompt diagnosis is vital, as symptoms can range from mild fever to seizures, coma, or death. Early treatment can dramatically improve outcomes, especially for bacterial causes. Cerebrovascular disease in children includes several serious conditions that affect blood flow to the brain. A perinatal stroke can occur before, during, or just after birth and is often associated with complications in pregnancy or delivery. In older children, strokes can be ischemic, where a blood vessel becomes blocked, or hemorrhagic, involving bleeding into brain tissue. One rare but notable condition is moyamoya disease, where narrowed vessels at the base of the brain lead to the development of fragile, abnormal collateral arteries that are prone to rupture or clotting. Prompt diagnosis and management are essential to reduce long-term neurological consequences. Epilepsy in children is diagnosed when a child has more than one seizure that cannot be explained by a temporary cause, such as fever or infection. These unprovoked seizures reflect an underlying neurological tendency toward abnormal electrical activity in the brain. Seizures themselves can stem from neurologic causes, such as brain malformations or trauma, or from systemic factors, including metabolic imbalances, infections, or fever. A common and typically benign type of seizure seen in children is the febrile seizure, which occurs in response to a rapid rise in body temperature. While febrile seizures are frightening to witness, they usually do not lead to long-term neurologic damage and are not considered a form of epilepsy. Brain tumors are the most common solid tumors in children and represent a significant cause of morbidity and mortality. Among the most aggressive is medulloblastoma, which arises in the cerebellum and can spread through the cerebrospinal fluid to other parts of the brain and spinal cord. Other malignant tumors include atypical pterygoid rhabdoid tumors, known for their rapid growth and poor prognosis, and primitive neuroectodermal tumors, which are embryonic in origin and affect young children. High-grade gliomas are also seen in pediatric populations and are characterized by rapid progression and resistance to treatment. Embryonal tumors in children arise from immature or undifferentiated cells and often develop early in life. Neuroblastoma is a common embryonal tumor that originates in the sympathetic nervous system, often forming in the adrenal glands or along the spine. It may be discovered as a firm abdominal mass and is known for its ability to spread before symptoms appear. Retinoblastoma is a rare eye tumor that originates in the retina and is most often diagnosed in young children. It can occur in an inherited form, typically involving both eyes, or as an acquired mutation, which usually affects one eye. Early detection is critical as treatment can preserve vision and prevent metastasis. This image illustrates the characteristic appearance of retinoblastoma, a malignant tumor that arises from the retina in early childhood. One of the most striking and early signs of retinoblastoma is a white reflection in the pupil, known as leukocoria, which is often noticed in photographs. Instead of the normal red eye effect seen in flash photography, the affected eye may appear white or yellow. Retinoblastoma can be inherited, in which case both eyes are often involved, or it can occur as an acquired mutation, typically affecting just one eye. Early diagnosis through pediatric eye exams is critical because this cancer can spread beyond the eye if left untreated. With prompt therapy, which may include chemotherapy, radiation, or surgery, the chances of saving the eye and the child's life are significantly improved.